Hello and welcome to The Nation. I'm Jared Rodnam. Obesity has become a major health concern with rising cases and serious long-term impacts, from viral weight loss hacks on TikTok to over-the-counter slimming pills. Many have turned or are turning to quick fix solutions, often without knowing the risks involved. So how do we navigate the overwhelming amount of information on weight loss, and what are the safest, most effective medical interventions available today? Joining us on The Nation is Dr. SATTIAN KOLLANTHAVELU, consultant physician, gastroenterologist and hepatologist, to help us separate fact from fiction when it comes to managing obesity and achieving sustainable weight loss. Dr. SATTIAN, thank you very much for doing this. And yesterday, the 4th of March, was World Obesity Day, and I'm sure you have a lot of questions to answer with regards to your industry and what you do now. I guess with what we're doing today, we want to get some understanding about interventions for those of us who are overweight, or those of us who have problem losing weight, and for those of us who want to look good. Now, I guess to start this off, let's talk about gastroenterology and hepatology. When you go to a hospital, you see a lot of different specialities and subspecialties. Sometimes we go there and we don't want to ask because we're afraid or ashamed to ask questions of this nature. So let's just start with gastroenterologists and hepatologists. For me and for the Rakyat Marhain, what does this mean?
Yeah. First of all, thanks for having me on air. So basically, I'm a gastroenterologist, hepatologist. We deal with digestive problems. That's right from the mouth down all the way to where we pass the poop, everything. Mm-hmm. At the same time, we learn to deal with hepatology problem. Hepatology basically means liver problem, because all these things are quite related. Along the way, and patients have other problems, including obesity, it's related to the metabolic problems, digestion, everything. So along some of our work approaches into obesity problems as well, because when you have obesity, you have fatty liver, all those things that comes up. Mm-hmm. So basically, as a gastroenterologist, hepatologist, we deal with problems related to digestions.
Right. So that's interesting that you say fatty liver. Now, a lot of that is also linked to diabetes mellitus. Is that true?
Yes, exactly. It always comes in a package.
Mm-hmm, mm-hmm. Now, obesity in Malaysia. So let's talk about obesity in our country. What's the status like at this point, and how big is it a problem in Malaysia, and what are the main contributing factors in your opinion, and to what you've seen? You worked in government, you're working in and in the private sector now. You understand, and you've seen a lot change in 10 years. So tell us what the situation is in Malaysia.
Okay, to be honest with you, we just got from bad to worse in obesity crisis, and at the moment we are number one in Southeast Asia.
Boleh.
Malaysia boleh, exactly. You saw the meme on the Facebook, right?
Yeah.
Okay, so it's Malaysia boleh, and we are number one in Southeast Asia. Putting it in numbers, every 1 in 2 adults and every 1 in 5 children is considered either in overweight or obese category. That shows how bad it is. To make it worse, most of the people lack understanding of what is obesity. They take it as a lifestyle problem, but they do not realize obesity leads to other problems such as heart problem, high blood pressure, and diabetes, and other related problem, knee problem, osteoarthritis, and also obstructive sleep apnea. Mm-hmm. Mm-hmm. Along the way, obesity always been a crisis. Along the way, pandemic happened, and during pandemic we had this lockdown, work from home, and all this accelerated the obesity crisis.
Right. So you talk about the pandemic, and I see the pandemic differently. So I would think that, and this is just my 2 cents worth, people who had problems a lot during the pandemic, mm-hmm, maybe was because of the whole gut-mind axis problem. Everyone's worried, mm-hmm, and that brings about gastro problems. Is that also part of it?
Yes, exactly. See, at the usual time, people wakes up in the morning, go to work, we do a lot of things, activity, we take our dinner, everything. But during a lockdown, their activities are limited. And most of the time, initial phase, yes, people were quite active. When it enters the 2nd, 3rd month, that's when people are becoming more sedentary lifestyle. If you look at it, at certain point, all this subscription, television, pay-per-view, TV, everything has gone up tremendously. It means more people are watching. Mm-hmm. They are moving less. At the same time, some of them got into they lost their job and everything, and they can't do much. They go into depression, and there's a very close relationship between depressions, mood swings, and food intake. Apart from that, there's a lot of these food deliveries. People started taking a lot of different kind of foods, and there was no opportunity for them to lose weight by doing activities, and they started gaining weight.
So it's interesting, while you're talking to me, my studio director just asked me a question, and he said, can you ask doctor if pancreatitis has got something to do with this also?
Whether pancreatitis, yes, it is associated with obesity, if especially they have a high level of cholesterol. But it's not applicable for everyone, but it can be associated.
It can be associated,
yes.
Not applicable for everyone.
Yes.
So it's associated, meaning it can be linked to high cholesterol levels,
yes.
which can bring about pancreatitis also.
Basically, pancreatitis is an inflammation of the pancreas.
So that's good news altogether for the rest of us, which means we really need to take care of our health. Now, lately we've seen a lot of viral TikTok trends and Instagram, of some of the most popular ways to lose weight, so on and so forth. As a gastroenterologist and hepatologist, which means someone who deals with the liver, what's your take on this? I'm sure you see it, and now I'm sure sometimes you're shaking your head saying, my God, what's happening here?
Okay, so this is a very tricky area, because you see, as a doctor that we deals with obesity, everything, we have a distance between the patient. Whereas in TikTok and all this Facebook, everything, Instagram, the influencers, they are easily accessible. They have hundreds and thousands of followers to back them up and everything. So whenever they promote something, they are readily more approachable. However, to see a doctor, you have to go through an appointment to get them. And then, in the busy clinic days, we probably spend 5 to 10 minutes talking to the patient. Whereas when they are more at home, they get access to all these things. Along the way, yes, we do face challenges. There are patients that comes to us first, then goes to all this whatever they see in social media. There are many patients actually gone through all these things, then finally come to us for help. There are some, very funny ways of losing weight, but none of it actually are proven to last long. In fact, in worst case scenario, it can cause a lot of other related problems.
Because every time just before this interview, I went on TikTok and looked at it, and a lot of times you get people speaking to the public at large saying, dulu makcik size makcik 80 kilo, sekarang dah turun ke 60 dalam masa seminggu je. It happens every day, and people, sometimes I get pulled into it because it's so interesting when you see these things happen. You say, maybe these things work. But in your opinion, I mean, even people are now talking about probiotics and asking, do they really work? So in your opinion, should people, is there anything out there which really helps people, for people who can't afford to go and see a doctor?
Okay.
I don't know if that's a valid question.
That's a very valid question, because you're asking for a layman term. Because, one thing I can tell you is losing weight is a journey. It's not a shortcut for that. You have to go through certain things in a proper way. Of course, whenever people put anything in social media, they do not own any responsibility towards it. And people can claim a lot of things, but studies, researchers have proven all these things may have some short-term effect, but eventually people start gaining back weight. I'm sure you heard of this funny terms, once a day meal, very low caloric diet, and there are certain things such as ice diet. People just take ice to burn calories and everything. The actual weight loss may not be much. And
it's not significant.
It's not significant. And for how long can you actually be on an ice diet? I mean, there's come a time that you need to take your proper diet and everything correct or not. So eventually you start gaining back weight.
Now the reality of weight loss is there's two ways of looking at it. Some people who've got a bad BMI, and some people who've got the BMI is normal, but they don't feel like themselves. They want to lose a bit of weight. They want to look good in clothes. So there's two categories of people we're dealing with first. So let's very quickly look at medically approved options available for those, say, struggling with obesity.
Okay. Before we understand about obesity, one thing we have to understand is it's not only about eating. The common person's perception is we eat a lot, we get big in size, obese, we gain weight. That is true. But At the same time, there's a lot of other things that plays a big role in the background, such as your family history, your genetic, or you may have some other medical problems such as low thyroid, or you may have diabetes. All these things need to be addressed as well. At the same time, there's some modifiable risk factors: work, stress, mood swings, depression, or those who are actually approaching certain age, they may have some hormonal problems. So when you're able to identify all this, then only you can go to the next step. And there are some as well, some with some what we call psychological issues, who may have actually feel a bit less confident about their body size and all this thing. But in fact, medically looking, they are actually within the normal
So
range.
do you have to look at these parameters, the psychological well-being, which means that the self-esteem, is that part of what you do as a gastroenterologist and hepatologist?
Yes, we may not be an expert in that, but we are trained to identify those problems, because if we do not treat that, patient will be able to get a wholesome treatment benefit. And whenever we manage obesity, it's actually, if you look at the National Obesity Guideline, everything, it is a multidisciplinary team. It's not a one-man show. It's a team of doctors that actually tries to work a good plan for patient to lose weight. However, like I said, when you come to social media, they do not owe any responsibility towards whoever's watching it. They just present whatever it is. But when you come to a proper medical this one, you have to see several doctors to get a proper management plan.
Now, okay, when you talk about management plan, when you go into a pharmacy, you get pharmacists telling you, okay, we've got this weight loss powder, something you can take as a meal replacement in the evening. What do you say to something like that?
Okay, I would not recommend getting those medications directly for one single reason. If you have not addressed your other medical issues, because some people, they wouldn't want to see doctors, they wouldn't want to check their thyroid levels, check their cholesterol levels, whether they're diabetic or not. So probably without knowing all the status, and you start taking medications that is not actually indicated for purpose, you may end up in more trouble.
So just saying, if it's just a shake, the pharmacist in this big pharmacy would have said, or in a pharmacy would have said, hey, take this medication, or take this shake, and it'll be good for you.
If it sounds too good to be true, probably it is.
It is too good to be true.
Yes.
So you would say stay away from that. Now, back in the day, I remember in the 90s and early 2000s, this pill was very famous, but every time you take this pill, you have to run to the toilet a few times. I don't know what the drug name is. I know the brand name, but I'm sure you've heard of it too. It starts with a Z, X, sorry. Yeah. Is that still...
Okay. So what happens with there are several forms of losing weight. One of it is that causes patients to start having diarrhea, lose weight and everything. But it ends up in many other complications. Some of them get dehydration. They do get some gastrointestinal issues as well. And subsequently, when this medication has been misused, they actually intended for good purpose, but many times it has been misused and all this thing, ends up, and more complications.
Right. So it ends up with more complications, which brings us to solutions that we have. So what are medical solutions that we have today that makes a difference?
Okay, first of all, I say any obesity management should be done by a multidisciplinary team. In our hospital, we have our endocrinologist, our dietitian, nutritionist, our anesthetist, eventually if they go for any surgical procedure or non-surgical method, as well as our psychiatrist. Psychiatrist plays a big role because, you see, like I told you earlier, endocrine is the doctor that manages obesity. They'll find out whether...
An endocrinologist.
Endocrinologist,
yeah.
Yes. They do manage address all the confounding factors, everything, and they need to find out what are the complications that's happening, what is the actual reason they want this be done. And second is a dietitian or nutritionist, where they will try to sort out what is the suitable caloric requirement for you, how much you need to take, and whether you need to go to a low caloric diet or very low caloric diet and start losing weight. When all these things fails is when you need to go for other less invasive or invasive method. Psychologists, psychiatrists, important role not to say that you have some problem, but we need to see whether you falls in the group that may have some eating disorders, which is a totally different group of management, everything. Furthermore, the patient that's going for bariatric surgical method, which I'll explain later, they may end up in more complication, and because of some hormonal changes, they may get some psychiatric issues as well. They go into depression.
Right.
Yes.
Right. So I've got a friend who personally took some kind of hunger suppressant, and you can see just straight off the bat after taking one or two pills, the person was getting nauseous and after a while feeling palpitations in the heart. Is that all common for people who take hunger suppressants?
Yes. It is common side effect that is seen. First of all, we need to see why was that medication given by whom, and whether a proper explanation has been given. We need to address all these things. You see, most of our doctors...
But people are buying it. My friend bought it off TikTok.
See, that's the problem with lack of enforcement. Lack of enforcement, easily available.
I'm not saying anything about TikTok. Yeah, okay.
Yeah. Lack of enforcement. So this leads to a very easy access to all this restricted medication, ends up in more complication. If you remember clearly, probably about 10 or 15 years ago, there's a very famous couple in Singapore. One of them went into a liver failure, had to have a transplant done. This was because one of the weight losing medication as well.
Mm-hmm. Well, because it was because of a weight losing medication.
Yes.
Now, very quickly, we're very quickly running out of time. I'd like to look at a few things. I've Googled. First is people swallowing a balloon. Now it's a big thing, and I know for a fact that a lot of people in my industry who still wants to look decent or presentable by industry standards. So they're told that if you're big size or if you're fat, you cannot read the news, or you cannot. So these people are really going out there and doing things that they shouldn't be doing. With a very low BMI, they're going and swallowing balloons, which you're going to talk to us about. And there's also now what you're doing, which is shrinking the stomach. It's called ESG.
Reshaping the stomach.
Okay.
That's a proper term.
That's a proper term. Reshaping the stomach. But so walk us through this. What are these things, and who should be doing it?
Okay, so if you see, traditionally we have medical therapy and also surgical therapy. So medical therapy is all those medications that you take to start losing weight. One of it is what we call as a glucagon-like peptide, which actually mimics it was used for diabetes and also for weight loss. Right. It's quite a famous medication.
Ozempic, the brand name is Ozempic.
Semaglutide and all this thing. So eventually, those group of patients takes medical therapy, they have benefit of losing, and many of these medication are being sold for weight loss. But what some patients fail to realize is it can cause a lot of side effects also as gastrointestinal symptoms. They can have gastric discomfort, bloatedness, and all this thing. They do lose weight, yes. But number two is the cost issue. Whether they can sustain it beyond certain duration of time, because it can be quite expensive. Once they change the medication because of cost issues, they start gaining back the weight.
Right. So that's the jab people are taking. A lot of self-jabbing going on just to lose weight.
Yes.
Yeah.
So, and then the bariatric method, where it's a traditional surgical method where we do a laparoscopic sleeve gastroplasty. Part of the stomach will be, disconnected from and removed from the
It's called a bariatric surgery, isn't it, for us lay people?
Yes. Yeah. So, our RU and Y is a bypass where, the food that you eat is get bypassed, digested.
So, is it done endoscopically? Is it done through here?
So, it's done surgically.
Surgically. So, there's a...
Yes. Normally, they'll do a laparoscopic. There's a camera, keyhole operation.
Keyhole surgery.
But just to clarify, I'm not a surgeon, so our job is to find a middle ground. So what we have, what has been going on overseas for many years is minimally invasive surgical procedure.
Well, what are we looking at here?
Here we are looking at several methods of interventional weight loss, which as I explained earlier, laparoscopic sleeve gastrectomy, and RU and Y bypass, and there's another gastric band surgery. There's one more picture that's not shown here, is a balloon. Balloon has traditionally been used as a bridge because it's a temporary solution. Eventually you have to remove it after several months. What we have, something new has been introduced in Malaysia, whereas overseas is...
So this is the balloon you're talking about?
Yes.
Yeah? Okay, so what I don't understand, I'm looking at the balloon now. The balloon goes in endoscopically, which means it's put into the mouth. It is pumped when it's in your
Yes, it's pumped to certain pressure to inflate, to make the stomach smaller, technically smaller.
Okay. And how do you leave it? How do you remove the...
So after several months, you deflate the balloon and just remove it endoscopically. So it's a non-surgical method, but it's a temporary for several. You cannot keep it forever.
Right. So, but your belief is, so while these are treatments that are available, your belief is this. So it's not what you think it is. It's something that you're going to talk to me about.
Yes.
So So what am I looking at here?
So okay, just across.
It looks like one of those toys, isn't it?
Yes. Basically, the balloons is a bridge. You can't use it permanently, but you need patient likes to go for, not many patient likes to go for surgical technique. At the same time, they want something permanent. So what we have here is endoscopic sleeve gastroplasty. Basically, instead of a surgery, we'll use the endoscopy, the same one we do as a gastroscope, to look into the stomach.
Right.
And then this device will be attached to the end of the scope.
Right.
And inside the stomach, we'll start reshaping the stomach using sutures only.
Right. So if you can show that to the camera again, just so the cam can get the view of this. Yeah, so this one, and it's this,
yes,
which you are looking at.
All
so
right.
this goes into the stomach, isn't
so
it?
and there's no surgical scars or anything. It'll be done under anesthesia,
Right.
and we enter it inside the stomach. We'll be attached to an endoscopy, the same scope that used to examine your stomach, the gastroscope,
Right.
under sedation, and we'll start reshaping, mimicking the sleeve gastrectomy where we do a surgery. Instead of that, we'll just suture to make the volume of the
I think
stomach
we've got
smaller.
a video of that. We can play that while we're talking here. So yeah, so it goes into the stomach and it sutures the stomach to reshape the stomach. This is what we're talking about. Isn't
Yes,
it?
exactly. So the benefit is it has a very short downtime, whereas in surgically patient may have to be off their routines for 1 to 2 weeks time. But with this, it can be done under daycare. Many hospitals keeps them for 1 day duration just to observe for all the side effects, everything.
Right.
It can be discharged the following day with a proper diet. There's a dietary plan,
Right.
and subsequently they can go back to their normal activities.
Yeah, so this is great that we're seeing this. Okay, let's look at it again. So this is the stomach. It endoscopically goes in the end of it, and it starts suturing the stomach. Is that?
Yes,
so
exactly.
when it sutures, it starts to reshape the stomach, and it shrinks it a little bit.
Exactly.
Right? How many percent?
It can shrink up to 70 to 80%.
Okay, so now with a 70 to 80% shrinkage, who will you recommend to be going for something like this?
For this, we need to check at the BMI first. If the BMI is between 30 to 40, they are ideal patients to go for this procedure because the expected weight loss is around 17 to 20%.
Right.
And this is with the procedure alone. However, if we combine it with, if the patient is on diabetic patient, we combine it with all this medication that I mentioned earlier, it can go up to 25%.
Can go up to 25%.
Yes.
Now, I know, and this is a fact. Can I have
Yes,
this?
sure.
So this is a fact, and I've spoken to a lot of people, especially people who work in the modeling industry, people who work in my industry. A lot of us are very conscious of weight, and you get women who have, or men who have an okay BMI, but they come to you and say to you, Dr. Satyan, I need this. I've heard about this. Can you tell me about this? Is your work to advise them or to sell it to them?
My work is to advise them. Because you see, before we go for any medical procedure has some associated risk. There's no 100% safe procedure. And we would like to work to get them address what is the actual issue. And if we know they are actually just borderline like that, I would not recommend them to go for any type of invasive procedure, whether it's minimally invasive or it's a proper surgical procedure, because they may end up in more complication than one they begin with. Instead, we like to address what is the actual issue needs to be done, and if possible to be treated medically, we'll do that.
Right. So this ESG, I know, is one of the new things in Malaysia, and you're probably one of the first to get it done. Yeah. So we'd like to congratulate you for that.
Thank you very much.
But in conjunction with World Obesity Day, what would be your message to Malaysians with regards to obesity? Now, I think one of our biggest problem is carbohydrates and sugar, right? Or basically carbohydrates, which is actually sugar.
Coming to that, we are lucky, we are multiculturals, and there's some, but the problem is with our food, we have to take care of our food because our food is caloric dense. So when that happens, every day we are taking a large amount of calories, sugar, of course, all these things you need to watch out first. And there's no shortcut for weight loss. There's no shortcut. You have to go through a proper doctor's guidance or dietitian, and it is a journey. Like all my patients, it's a journey. Do not rush into the procedure straight away, anything. There's no shortcut, because it's not only about losing weight, it's about maintaining whatever you lost, not to regain it. And with every medical procedure they're going to do, there are some sort of complications, some sort of risk involved. As long as you understand all these things, the doctors, they are there to help.
So doctors are there to help, and I think the most important thing is for those of us who And this, once again, I know people who have a problem with weight, they really need to go see doctors and try to get a solution using one of these procedures. Now, for those of us who want to keep in shape and do the best to ensure that we're showing up for our work, we really also need to check with doctors, because in the end, what you're doing will be done on TikTok also. And I'm really worried about stuff like social media is really teaching people good things, and also there's a lot of bad stuff out there.
Exactly.
So with regards to choosing a procedure, what is your advice?
In regards to choosing a procedure,
we've got about 1 minute left here.
There's no one size that fits all.
Yep.
Every procedure you need to see whether it's suitable for you to be done or not. And if you're not sure, before you decide to take any type of procedure, do get consultation with doctor. It's not going to cost much, and it probably is going to cost much lesser than whatever you may end up with.
Right. So what we're learning here is, if you really want to do a procedure, don't go and ask for a procedure. Check with the doctor, or maybe 2 or 3, to get a couple of some
Proper
feedback.
advice,
Yeah,
yes.
Proper feedback and proper solutions as to how you're going to move forward with this. And that was definitely a very insightful discussion on obesity and safe weight solutions. We'd like to thank Dr. Satthian for making his way here into the studios of Bernama to tell us about this, and also in conjunction with World Obesity Day. Take care of your health. Anything else you want to say?
Stay healthy, do exercise, and see less doctors for this problem.
With that, I'm Jared Ratnam signing off. This has been The Nation on Bernama TV. Thank you very much for staying with us. We've got news updates coming up. Stay with us right here on Bernama TV. Thank you.